Case Study Neurological Disorder Part 1. You arrive on scene to a 54-year-old female who is complaining of bilateral limb weakness, neck stiffness, and headache. After assessing scene safety, you notice the patient is with her adult child, who is visibly anxious about his mother's condition. The patient has recently had COVID a couple of weeks ago, where she was able to manage it at home, with the assistance of her children. Over the past few days, she has started to feel worse with increased weakness in limbs, headaches, and neck stiffness. Today she called an ambulance as she is having increased coughing spells and has shortness of breath on exertion. After seeing that the patient is alert, you decide to complete an EE assessment, airway, patent, clear as the patient is talking to you but unable to complete sentences. Breathing assessment. Respiratory rate 28, oxygen saturations are 94% on air. Work of breathing is labored, equal rise and fall of chest. On auscultation there is bilateral expiratory wheezing. On percussion the chest is resonant, cough and shortness of breath on exertion. Circulation assessment. Color is pale, heart rate 112, pulse is weak and thready. Blood pressure 148/78, capillary refill time under 4 seconds, ECG atrial fibrillation. Disability assessment alert, GCS 15, blood sugar 5.2, pupils are equal and round, reactive to light and accommodate, fast test negative, temperature is 35.8. Pain score of head and joints 7 out of 10. Exposure assessment top to toe, front to back maintaining dignity where there was no signs of any injuries sustained, no signs of bleeding or rashes, no bruising, swelling or deformities. No photophobia, no paralysis. There was pain on palpation of joints and numbness and tingling in limbs. Pertinent negatives. A brief review of systems is negative for hemoptysis, tracheal deviation, distended neck veins, chest pain, palpitations, cyanosis, nausea, vomiting, diarrhea, change in urine output, abdominal pain. Allergies include penicillin and latex with no other known allergies. Medications the patient is currently taking include tramadol, Ventolin, bisoprolol, metformin, digoxin. Past medical history: rheumatoid arthritis, asthma, hypertension, type 2 diabetes, atrial fibrillation, anxiety. The Sun said the patient suffers with white coat syndrome, where she can feel worse around medical professionals. Part 2 coming soon.